This is Priyanka Sarkar, and welcome to the Sports Soul, a space where we explore the real stories and emotions behind strength in sports and in life.
There are very few words that change the temperature in any room. Death, cancer, a misdiagnosis. Cancer is very frightening even to think about. But imagine the person who is going through it and the family that is kind of supporting him. Cancer doesn't just put a halt in your life. It also stops those people who are supporting you, family members, relatives, friends, your workplace. It all brings it to a halt. And one specific field of professionals who work in this field are called onco-psychologists. Onco-psychologists are those ones who work around cancer patients and families who have people affected with cancer. So I have somebody who is an onco-psychologist. She will help us understand what happens to the patient, to the families, and how can onco-psychologists help, and what is our role in as a part of a society or family or friends or a support system, as how we can help with those with cancer. And Sophie, thank you so much for gracing one of my episodes. And as I said, there are very few onco-psychologists, and when I checked on LinkedIn, you're probably the only one who came up as an onco-psychologist in Hyderabad location. So can you help us understand what does one has to study to become an onco-psychologist, and what is your line of work?
Okay. First of all, thank you for inviting me for this podcast. And this is a very, very important topic about psycho-oncology. So one has to have a master's in psychology, and they can do a specialization in psycho-oncology.
Okay.
So if the person have some exposure or some experience in the oncology setup, will be an added advantage for them, because then only they will know studying is one part, and getting to know the patients in another part. So that is a basic requirement of working as a having a qualification of a psycho-oncology. And psycho-oncologists train chestarante, so they assess the patients. So they come to the hospital, they come to with the diagnosis or whatever the treatment or it is kada. So వాళ్ళు వచ్చినప్పుడు అసెస్మెంట్ చేయడం, అసెస్మెంట్లో డిపెండ్స్ అండ్ వాట్ ఎవర్ వాళ్ళకి ఏం రిక్వైర్మెంట్ ఉందో దాని ప్రకారంగా దెన్ ప్లాన్ ఏ ట్రీట్మెంట్ ప్లాన్ ఫర్ దమ్, అండ్ వాట్ ఎవర్ ట్రీట్మెంట్ మోడాలిటీస్ వీ కెన్ అప్లై, వీ ప్లాన్ అకార్డింగ్లీ అనమాట. ద హైలైట్ ఏంటంటే దీనిలో జనరలీ పీపుల్ కమ్స్ విత్ సింగిల్ పర్సన్ ఆర్ ద కపుల్ థెరపీ కోసం కదా. సో దీనిలో ఏమవుతుందంటే ఒక పేషెంట్ వచ్చినప్పుడు పేషెంట్తో పాటే వాళ్ళ ఫ్యామిలీకి కూడా it is very important, because diagnosing cancer is an upside event for anyone. So it will affect the family members as well as the patient. So that is a line of work.
I want to talk something very personal, Sophie. This is something that has changed my course of direction or my course of purpose in life. I was working in Bangalore from 2014 to 2017. I was an IT professional before I became a sports psychologist. I had one friend, I do not want to take their name so much, so that they're so much a part of my life.
Yeah.
But I do not want to take out their names for privacy issue. There were 3 friends, 2 from office and 1 from my Hyderabad days.
Okay.
So both of them were girls, and both of them had night shifts along with me.
Okay.
Both of their fathers had cancer. So these girls would go take their fathers to chemotherapy or radiation in the morning, come back to office for their night shifts. And one particular friend, I've known her only just like a general friend. She didn't come for a week to office. I asked, I didn't see you in the office. We used to meet at lockers. I clearly remember this very clearly. I asked, dear, I didn't see you in the locker. I haven't seen you for some time. And she says, I lost my dad. I said, I'm so sorry to hear that. She said something that stayed with me for the rest of my life. It has been 2014 until 11 years?
Yeah.
She said something, it's okay, Pri, you didn't know. And then Few months later, my friend from Andhra Pradesh lost her mother due to cancer.
Yeah.
I said, should I come? Should I come? She said, no, do kangar padaku. Mummy wouldn't want you to cry because
Yeah.
I was so close to her mother as well. She said, Mummy wouldn't want you to cry. You don't come here.
Yeah.
I will manage everything.
Mm.
And then I just started doing my psychology as a working professional.
Yeah.
I come home after a few months, and my third friend, who never cried in her entire life,
Yeah.
she calls me up and says, Priyanka, daddy passed away. And for that particular phase of my life, ఎవరికన్నా జ్వరం వస్తే నాకు అదేమీ కాదు, ఓన్లీ క్యాన్సర్ ఈజ్ అన్ ఇష్యూ, రెస్ట్ ఆఫ్ ఆల్ వీ కెన్ ఫిగర్ అవుట్. ఫర్ మీ క్యాన్సర్ వాజ్ సంథింగ్ దట్, oh my god, my friends are struggling and they are yet supporting me, they are holding me. Is it something that I am a psychology student, I am an independent woman who has moved from one state to another state to work, and then they are holding me.
Yeah.
I do not know, back then we never knew anything like an onco-psychologist existed.
Yeah.
So I asked myself so many times over the period of time. She said, it's okay, Pri, you didn't know. Was there anything that I would have done differently had I been there, or had I known that her father was down with cancer? And I keep thinking about it. So I want to ask you something. Is there anything different that we can do when we know that our extended families or families have people who have cancer? Or what is your role as an onco-psychologist in the field of mental health?
Okay, so I'm so sorry that you were also feeling bad about that, but though you are a psychologist, end of everything, we are human beings.
Yes.
We do have emotions, so that is natural, isn't it? That's okay to feel in that way. And if some distant relative or immediate relative, or if you come to know that somebody is diagnosed with cancer, if you are okay, you give them support, moral support. Again, there are things, ఇప్పుడు ఏంటంటే చాలా మంది కూడా క్యాన్సర్ తెలిసినప్పుడు మల్టిపుల్ ఆప్షన్స్ ఇస్తారు. ఇప్పుడు అవును, యూ గో దేర్, you'll get better treatment, or go here, or cut white, or cut carbs, or whatever it is. All WhatsApp University forwarded messages they will receive, and they have to listen because they can't say anything. They come home and tell all these things kada. So పాపం మా పేషెంట్స్ ఫ్యామిలీ అంటే వాళ్ళు ఏం చెప్పలేకపోతారు, చెప్తే వీళ్ళు ఏమైనా ఫీల్ అయిపోతారేమో అనేసి. So better if somebody like that, if you're supporting them, give them moral support. Manaki unnecessary, if you are not sure about something, don't give any advices. Just go with them, talk about things happening around, or how are they feeling, if they are comfortable. Because there are a lot of cancer patients, they are not comfortable talking about their conditions. So they wanted to people go and see them as a normal human beings, not like అయ్యో క్యాన్సర్ వచ్చిందా, క్యాన్సర్ వల్ల ఇట్లా అయిందా, అందుకే వెయిట్ తగ్గరా అని మాట్లాడకుండా మామూలుగా మాట్లాడండి, వాట్ ఎవర్ ఇట్ ఈస్. సో దాట్ విల్ బి బిగ్ రిలీఫ్ ఫర్ దమ్, థింకింగ్ దట్ yes, I am there as a normal person, though they are taking treatment. So that will be big support for them, whoever is supporting people. On the other hand, I won't say that if somebody is advising whatever healthy tips and all that, it's okay, their intentions are good, but please understand that there is another side of reaction to the patient. That is also we have to understand.
That's where I'm coming. My support is just moral support.
Yeah.
But yours is a professional support.
Yes.
So what is your role in this?
So my role is, as a psycho-oncologist, I will be there from the time of diagnosing till the treatment over and till the follow-up. Till there I will be there. So almost I will be there throughout. So they feel a lot of emotions. There will be an emotional roller coaster for them. Some day are good, some day are bad, some day they will stable, and some day they don't feel anything. So all those times, we have to tell them, or whatever appropriate treatment modalities we have to sometimes it is a cognitive behavioral therapy, or sometimes it is a giving them some grounding, teaching them some grounding exercises, or sometimes it is giving them a small goals, or to find their identity, because identity loss is also a one thing, because before that they were something else, and after diagnosing cancer they are now nobody. Suppose an athlete, after diagnosing cancer they are no one, they are just a cancer patient then. So the identity loss is one thing, and it could be because of the weight, they lost a lot of weight. The entire personality can change. I often hear patients saying that, madam, నేను బయటకి వెళ్ళలేను because నా డ్రెస్లు అన్ని పట్టట్లేదు, నాకు ఇంకా పీపుల్ బయటకి ఏమైనా వాకింగ్ వెళ్తామంటే అందరూ ఒకలాగా చూస్తారు నన్ను, సో అందుకే ఐ జస్ట్ డోంట్ వాంట్ గో, ఐ విల్ బి ఎట్ మై రూమ్, ఐ విల్ బి వాచింగ్ టీవీ ఆర్ సిట్టింగ్ దేర్, అంతే వాళ్ళు. సో whenever whoever comes to me and whatever problems, so these are the problems majority of them, again they'll have a lot of anxiety, depression, stress related issues. These all will come along with that. So accordingly we do the treatment management, and end of everything, assuring them that whatever they are feeling is valid, it's okay, that is how it should be, that is normal. You don't need to be strong or positive or grateful all the time. It's all right if you're not feeling okay, it's that is there, you're not feeling okay, we are validating that. Simple talk, or just giving them assurance, most of the time it works. And coming to the patient attenders, the family members, they will also have a lot of issues, because they will not know, most of them will not know, to whom to talk. Whoever they goes to, they will get unnecessary advice. So they, most of the time doctors are busy, obviously they are busy, they have to deal with so many people and patients. So how to deal with it, and they already వాళ్ళ పేషెంట్ అంటే they will బాగా బర్న్ అవుట్ అయిపోయి ఉంటారు, because they have to finances చూసుకోవాలి వాళ్ళు, because treatment, as you know, the treatment are pretty expensive. There are so many families and patients I know that they sell their lands అదన్నీ అమ్ముకొని they will come for treatment. సో ఇదన్నీ బర్డన్ అయిపోతుంది, అరే అది అమ్ముకోవాలి. అగైన్ పేషెంట్స్కి కూడా ఇది ఇబ్బంది అవుతూ ఉంటుంది, ఎందుకంటే దే ఆర్ సీయింగ్ కదా. సో పేషెంట్ అటెండర్స్కి ఈ బర్న్అవుట్ వల్ల, స్ట్రెస్ వల్ల, యాంగ్జైటీ వల్ల పాపం దే విల్ ఆల్సో సమ్ వేర్ break down కాకుండా, we have to talk to them and make them understand, putting them into some group therapy or group discussion, encourage them to talk, communicate openly. So if they can't say, we put through in a different way to the patient, or make them understand things. So that is majorly we do that in our this thing.
Sophie, I want to ask you something. The moment somebody is diagnosed with cancer, there are a lot of emotions that go through. Fear, anger, why me? Sometimes people say, nenu smoke cheyaledu, nenu drink cheyaledu, why did I get this? And sometimes it is like, maybe God hates me, or maybe I deserve this karma. How do you deal with uncertain emotions that a patient comes with you? And I also want to add another angle. One friend of mine told me, Priyanka, I was watching my father, and in Majran Nidra Lechan water tagdaniki, I saw my father struggling in that little dim light that we switched on in his room. I saw him struggling. And that moment I felt, maybe ఈ పెయిన్ ఆగిపోతే డాడీకి, ఇఫ్ వీ కెన్ స్టాప్ ఆఫ్ దిస్, డాడీకి ఆ పెయిన్ ఉండదు కదా, డాడీ విల్ గో లైక్ ద వే ఐ ఇమాజిన్ హిమ్ టు బీ, అండ్ హీ విల్ ఆల్సో బీ డన్ విత్ ద పెయిన్. అండ్ దెన్ దెర్ ఇస్ అ గిల్టీ ఫీలింగ్, అమ్మో నేను ఏంటి ఇలా అనుకుంటున్నాను, ఐ నాట్ ట్రయింగ్ ఇనఫ్. అండ్ హౌ డు యూ డీల్ విత్ ద raw emotions that a patient comes with? And how do you deal with the guilt that the family members come with, or the feeling that they haven't done enough? How do you, these are two different kind of emotions altogether. And how do you deal with that?
అన్ని నాకెందుకు ఇది అయింది, నేను ఎప్పుడు సిగరెట్ తాగలేదు, మందు తాగలేదు, బయట తినలేదు, అంత సరిగా ఉన్నాను కదా, మళ్ళీ ఎందుకు నాకు వచ్చింది అని. అటెండర్స్కి ఇది పేషెంట్ సైడ్ ఉండొచ్చు, దీస్ ఆర్ ద ఫ్యూ. అండ్ అటెండర్స్కి కూడా ఏంటంటే, they have to see the finances. It is a very big, we do I mean, superficially if we say that, finances ఏముందిలే ఇన్సూరెన్స్ ఉంటాయి అందరికి, బట్ ఇన్ ఇండియా వెరీ లెస్ పీపుల్ హ్యావ్ ఇన్సూరెన్స్. ఓకే, అండ్ whoever comes to my interaction with patients, and they sell things, they sell houses, lands, and comes for treatment. Okay, and ఏంటంటే పేషెంట్ అటెండర్స్కి ఇప్పుడు వాళ్ళ జాబ్ చేస్తున్న వాళ్ళ అయిందనుకోండి, దే హ్యావ్ టు టేక్ కేర్ ఆఫ్ ద ఆఫీస్ వర్క్, and also they have to take care of the whoever is affected, I mean whoever is diagnosed with cancer, tanadi kuda chuskovalsi vasundi. So it is very overwhelming and very demanding for the attenders as well, which is not addressed anywhere because they are constantly running acha chemotherapy or radiation therapy or doctor pilisharu, then testlu untai and kotta news emero, I mean kotta result, what would be the result will be, and inga enni rojulu untundi ఇది. సో అలాంటి వాళ్ళకి చాలా ఉండే ఆ అక్యుములేట్ అయి ఉండే బాటిల్ అప్ ఎమోషన్స్ అంటాము కదా మనం, అలా ఉంటాయి అనమాట. సో అదన్నీ వాళ్ళకి ఒకవేళలాగా గిల్ట్గా బయటకు వస్తుంది. యాజ్ యూ రైట్లీ సెడ్ దాట్ లుకింగ్ అట్ ద డియరెస్ట్ పీపుల్ ఆర్ సఫరింగ్ సో బ్యాడ్ అండ్ వీ ఫీల్ దట్. See, that is also human. We are human beings. We do feel emotions and that is very important. Acknowledge cheyadam is important. But ఏంటంటే in India we don't have euthanasia or anything that sort of. But again, addressing that అయ్యో నేను అట్లా అంటే, that's enough. You are addressing it. You are coming to us and telling that అయ్యో అలా అయిపోయింది మేడం, నేను అడ్జస్ట్ తప్పు ఉందా అంటే లేదు, ఇట్స్ ఓకే, మతలబ్ you are feeling it, you came and told, but you are not acting on it కదా. Again, it is very disheartening to see those who close to you are suffering like that. You see, I personally have I personally have people who are I still get cry if there is not a single day goes వాళ్ళని ఆలోచించకుండా. So they were those that close to me. So ఏంటంటే we acknowledge emotions, validate it and do accordingly. What if? Then there is a cognitive structuring will come as what if not, we can ask some again, మీ ఆలోచన ఇట్లా ఉండే, వాట్ ఇఫ్ మనం అట్లా ఆలోచిస్తే ఎట్లా ఉంటుంది, వాట్ ఈస్ ఇట్ అని చెప్పి అలా వీ కెన్ గివ్ స్ట్రాటజీస్ టు దమ్. అండ్ పేషెంట్స్కి అయితే assuring them that they are receiving the best treatment available undi valaki. And as you said, ఇప్పుడు guilt ande, it is not anyone's fault that somebody is diagnosing with cancer కదా. ఇట్ ఇస్ నాట్ ఎనీవన్స్ ఫాల్ట్. ఇప్పుడు మీరు సిగరెట్ తాగిన వాళ్ళకి మాత్రమే క్యాన్సర్, థ్రోట్ క్యాన్సర్, లంగ్ క్యాన్సర్ వస్తుంది కాదు కదా. ఓకే, ఇట్ హ్యాపెన్స్. ఇప్పుడు నెక్స్ట్ ఫర్దర్గా మన దగ్గర ఏముంది? సో వ్యాలిడేటింగ్ దేర్ ఎమోషన్ ఈస్ ద ఫస్ట్ స్టెప్. సెకండ్ ఈజ్ whatever possibilities are there for them, the treatment, psychoeducation మనం చెప్తాం కదా. Psychoeducationలో we tell them that this is, I mean, though the doctors are telling them or informing them about the treatment part and all that, in psychoeducation also we tell them that that is a reaffirmation for them. మళ్ళీ అడుగుతారు, మీరు 10 సార్లు పేషెంట్ అడుగుతారు, మేడం లేదు మేడం ఇలా అవుతుంది ఐఎమ్ ఫీలింగ్ సో బ్యాడ్, నాకెందుకు వచ్చింది. The 10 times we have to tell them. And that's, I feel that I should tell them 10 or 20 times. That's okay. That is how they get that confidence. It's all right, I'm good, taking good treatment, the treatment is available for me right now. I mean, like that we can take forward the patient.
There is something that I also want to ask. When somebody is affected with cancer, until then they're a father, working professional, successful player, a homemaker, the best person out there in the room, but all of a sudden it's gone.
Yeah,
they just become patients. There's an overnight shift, the tables turn 180 degrees, and there are bills to be paid, there are identities as crisis. I want to ask, how do you deal with that identity now, misaligned identity with purpose for the next few days of life? How do you deal with that?
See, most of the patient will have identity crisis because, see, as you said, some working professional or or a athlete or a whatever work they are doing, they will not be able to do that anymore, at least for certain period of time, because వాళ్ళ ట్రీట్మెంట్ ప్రోటోకాల్ అన్ని అవ్వడానికి, దాని నుంచి రికవర్ అవడానికి చాలా బాగానే టైం పడుతుంది వాళ్ళకి. బట్ అది తర్వాత విల్ దే ఏబుల్ టు డూ ద సేమ్ వర్క్. ఇప్పుడు అథ్లెట్ అనుకోండి, వాళ్ళు ఎట్లా కోపప్ చేస్తారు, సో దట్ వీ కెన్ గివ్ దమ్ ఆల్టర్నేటివ్, హౌ కెన్ దే హెల్ప్ అదర్స్ టు కోచింగ్ లాగా వెళ్ళిపోవచ్చు. దే కెన్ టేక్ సమ్ అదర్ the same profession they can take other ways anamata. So they can coaching ki vellochu, they can they can help people to same path lo elina valaki they can help them to understand more alanti different ways. I know few of my patients who were working in a bank or some other sector. So once they diagnosed and they took treatment and later they were not able to go back and do the work, and they did come to hospital and help the patient and telling the experience to the patient and coaching them or writing books, and they become authors. So alla chaala mandi telusu anamata. Again there are jobs where they can go back if the patient is young, and if they can go back, yes, they can go back to work, but it takes some time. They need all the support. I think most of the people are very supportive towards people who is diagnosed with cancer ani anukuntunanu. So far I know
the world is a kind place, Sophie.
Yes.
There are always mishaps, misalignments, but world is a kind place.
Yeah.
But talking about kindness, the patient is trying to cope up. They are not kind to themselves because of the various raw emotions that they are experiencing. How does this affect the relations they have with their family members, friends, and close circles? How does it affect?
Yeah. So diagnose అయిపోయినప్పుడే see most of the patient ఏమైపోతారంటే they will isolate themselves. It is not wantedly, knowing that అరే వేరే వాళ్ళకి తెలిస్తే నా గురించి ఏమనుకుంటారు. that is one thing. Second thing is, ఇప్పుడు చాలా మందికి తెలిసిపోతే అందరు వచ్చేసరి ఇన్ఫెక్షన్ వస్తుందేమో అని అడ్వైజ్, obviously ఉంటుంది కదా, అది కొంచెం సమ్ పార్టీస్ దాట్, అదర్ పార్టీస్ అన్నెసెసరీ అడ్వైజెస్, అది వాళ్ళు వచ్చి చెప్తారు. లేకపోతే మిమ్మల్ని చూసి అయితే అదేంటి అంత తగ్గిపోయారు మీరు, అంత బాగాలేదా మీకు, అది అంటే ఇంకా కొంచెం యాడప్, అంటే వాళ్ళ ఇంటెన్షన్ అది కాకపోవచ్చు, బట్ ఇమోషనల్లీ ఆల్రెడీ దే ఆర్ వల్నరబుల్ కాబట్టి వాళ్ళు ఇంకా వేరే విధంగా ఆలోచిస్తారు. సో దీస్ ఆర్ ద ఫ్యూ రీజన్స్ వేర్ they isolate themselves. And relationship ante patients, I would suggest patients to express whatever they are feeling. That is very important, rather than being too strong or too positive all the time. Express whatever you are feeling, and it is okay, and they have all the right to express also. They have been going through so much, because they will taking chemotherapy will make you fatigue, they will have a lot of body pains, treatment side effects, and all the brain fog, all those things will be there with them. So sometime they will, and so we teach them emotional regulation and some grounding techniques which will be having lot of effect, which is very proven technique to calm themselves down. And journaling, which is whenever they feel emotions on high, I ask them to write it down, and whenever they come for the next session, we go through it and we find out what are the triggers they had and how they reacted to that. So after certain period, we can identify the triggers and we work towards it. What are the, is that relatives are attending, coming to see you is the trigger, or is it family is telling you something and the certain period is the trigger. So accordingly we modify it anamata.
I'll ask you one thing.
Yeah.
If I hold somebody's hand, will cancer pass on to me?
No, absolutely right? No.
So now, how does cancer affect the intimacy of partners?
Okay, so that is a very, very, very big, a good question, I would say, because in India we don't talk about intimacy or anything that sort of. We feel that it is not to be talk in front of people or not to be shared or anything that sort of. But again, intimacy can get affected because the patient is undergoing so much, first thing, emotionally and physically. On the other hand, the partner is also and
Wow.
going through something, not a chemotherapy or anything, but emotional burden or doing things. If they wanted to have, also the patient will have, most of the patients, suppose the patient is CA breast అనుకోండి, సో వాళ్ళకి బ్రెస్ట్ రిమూవల్ చేసిస్తారు. సో ఆ బాడీ ఇమేజ్ ఇష్యూస్ వస్తాయి వాళ్ళకి. ఆబ్వియస్లీ దే విల్ సో కాన్షియస్ అబౌట్ దెమ్సెల్వ్స్, ద సెల్ఫ్ ఎస్టీమ్ వాళ్ళకి ఉంటుంది. సో దే లూజ్ వెయిట్, అదర్ కేసెస్ ఆల్సో దే లూజ్ వెయిట్. సో ఆ బాడీ ఇమేజ్ ఇష్యూస్ ఉంటాయి వల్ల కూడా ఇంటిమసీ చాలా మందికి తగ్గిపోతుంది. దానికి ఏం చేస్తామంటే మనం కపుల్ కౌన్సిలింగ్ ఇస్తాము. కౌన్సిలింగ్లో ఏంటంటే వీ టాక్ ఓపెన్లీ, కమ్యూనికేట్, దిస్ ఈస్ హౌ ఇట్ ఈస్ గోయింగ్ ఆన్. సో ఇలా చేద్దాము, ఇలా చేస్తే ఇంటిమసీ ఆల్సో క్యాన్ బి లిటిల్ థింగ్స్, మేబీ కుకింగ్ ఎ మీల్ or keeping the bed neat and tidy or making something or gifting some small things, giving handwritten letters to them. So those also can come into intimacy, or hugging కానీ kissing కానీ అలాంటిది కూడా. So that is how we encourage them to do, so that part will be taken care of. But again, all patient will not accept for the same. So then explaining them, or making them understand so and so reasons, so and so, like this you can do, there is a better ways of doing it rather than having conflicts ani cheppi.
Can I ask you something on the same line? Intimacy doesn't spread cancer.
No, absolutely no.
And it is okay for people to be intimate even when they have cancer.
Yes.
Right?
Yes.
You said something, being positive, think positive. That is not how things work.
Yes.
No, there is a lot of buzz around positive thinking. With all due respect to that line of work, how is thinking positive and being positive not working on your own mental health? Or can I say, is it helpful, or does it just create pressure?
Okay, so first thing is, cancer won't spread, or it is not contagious to the partner. It is not infected. It won't get infected to anybody if they are intimating. Second thing is that, of course, you have to be careful when the partner is taking chemotherapy and when they are low on immunity. Then there is a high chance that patient will get infected from you, not from the patient. The partner will not get infected from the patient, from the partner. Okay, the patient can get infected
only
definitely.
because of the low immunity levels.
Because of the low immunity, because they are going on treatment, no? So the the immunity will be low level, and that can affect them. So accordingly, they can plan their whatever they want to do. And coming to the positivity, yes, there are a lot of buzz on being positive, stay positive, that will change your life. But of course, I do respect that whatever they are doing, that is with the positive, good intent. But again, is it possible? I don't think it is possible to stay positive all the time. You see, we are human beings. We are allowed to have all the emotions, and definitely we'll have emotions, isn't it? It is not necessary that the patient have to hide the emotion and to stay positive, to show up someone. Obviously, that create a lot of pressure, because they have to compromise their other emotions because ఎవరు వాళ్ళకి పాజిటివ్ ఉండాలి, మీరు అది ఉండని ట్రీట్మెంట్ బాగా పనిచేసని. ఆబ్వియస్లీ పాజిటివ్ ఇంపాక్ట్ ఉంటుంది అనుకోండి, కానీ ఆల్ ద టైం ఉండడం కుదరదు కదా. మనం మనుషులు కదా, దే విల్ హ్యావ్ లాట్ ఆఫ్ ఇమోషన్స్. పాప వాళ్ళకి ఏంటంటే అలా ఇమోషనల్ రోల్ కోస్టర్ అవుతూ ఉంటుంది అనమాట. ఒకేసారి వాళ్ళకి ఆనందకరం ఉంటుంది, దెన్ దే విల్ ఫీల్ సాడ్. దట్ ఈస్ వెరీ నార్మల్ ఇన్ దిస్. సో ఐ వుడ్ సే దట్, మీ ఎమోషన్ అడ్రస్ చేయడం ఈజ్ ద బిగ్గెస్ట్ థింగ్. అడ్రస్ యువర్ ఎమోషన్, దట్స్ ఆల్ రైట్. పాజిటివిటీ ఫైన్, కానీ మీ ఎమోషన్ మీరు అడ్రస్ చేసుకోండి, దాని ప్రకారంగా వీ కెన్ వర్క్ ఆన్ ఇట్.
So how do you distinguish between a fake positivity but authentic resilience? There are two different things.
Yes.
The patient is keeping up with the fake positivity because he was asked to, or that resilience or the mental toughness that comes from within saying, I will beat this. There's a difference between I'll beat this, but then secretly cry because I know exterior strength, But there is something also we call as authentic resilience that comes
Yes.
from within.
Yes.
I know today is a bad day.
Yeah.
It has been hard on me,
Yes.
but I'll get back.
Mm.
I'll bounce back. How do you, as an onco-psychologist, distinguish between these two?
So, see, first thing is that whenever patient comes to a psycho-oncologist or a psychologist, to the cabin, they are very open. Most of the people are very open. So, I will only see if they ask how to stay positive, because I am not feeling good. All the overthinking, a lot of thoughts are coming to my mind. I can't keep my mind straight. A lot of what if the disease come back, or what if my results are. So many things are, coming into my mind. I can't keep up. I would tell them that, the same thing. You don't need to be positive all the time. See, whatever we are doing it, as you rightly said, that can create a lot of pressure on them. So end of the day, they will bottle up. The emotion has to come in some way. That could be like, showing a lot of anger or irritability or anything that sort of. And that is not helping them. And on the other hand, authentic, positivity or authentic resilience, that has to come within. When you understand yourself well, you understand your disease well, you understand the treatment well, then you can understand yourself in a better way, because since you are taking a lot of treatment, isn't it? When you know all these things, you will also feel that yes, treatment are going as per plan, and if I am feeling low, that's okay, and addressing it. And I am feeling anger because all these things are coming there. So today I am feeling calm because I spoke to ma'am, or today I am feeling little irritated because my IV line is not, the nurse is not finding my IV line multiple times and it is paining, and I am feeling fatigue and I am feeling tired. That's all right. So for very important thing is that addressing your emotions. Address it. It's okay. It's normal that you have all the emotions.
There are long-time survivors.
Yes.
They have survived for a long time. And then they have post-trauma.
Yes.
And they also have survivor's guilt.
Yes.
How do you handle them as onco-psychologist?
So, long-time survivors may experience guilt, like why me? Why did it happen to me? And they do have anxiety and stress, whenever the checkup time comes in. So that is there, and also they do have, they have, continuous tension or stress on, what if this comes back? What if the disease comes back? What will happen to me then? What will happen to me because I've been already, I have been through so much and I don't want to go through it again. So there are a lot of thoughts and tension and stress on that. And there are other people. There are people who are survivors. They have feeling greatness or finding their purpose in life, like they go out to coach people. They found they'll get into some NGO work to help others and to tell them that to help them understand cancer treatment and cancer journey in a better way, write books and educate people or help them throughout like that.
How does the neuropsychological from a neuropsychological perspective, how do prolonged treatments kind of impact the pain, the fatigue and chemo on the emotional regulation?
Yeah, see, when the patient is undergoing chemotherapy or radiation therapy or surgery, so it is very difficult for them to have an emotional regulation, because there are a lot of pain, constant pain, and chemo side effect if they are going, and a lot of fatigue, and all these emotions will not allow us to have emotional regulation. That is normal. And when chemotherapy can slow down the attention span, it can reduce your focus on things. Suppose some patients go and open the fridge and they think that where did I keep my specs, or they go on searching something which is just in front of them. So those thinks that this kind of incident can happen, but over a period of time they will get over it, but it will be there for it is kind of a side effect of the treatment, and overwhelming of the emotions, all those things. But again, emotional regulation is not possible in some times, but yeah, that is how it is.
So let me ask you something. With AI coming, evolved technologies and telemedicine, how do you see emotional intelligence becoming as important as medical intelligence? Because now with AI coming, everything says, ఇది తీసుకోండి మీ క్యాన్సర్ తగ్గిపోతాయి, క్యాన్సర్ కణాలు కాలిపోతాయి, మీరు ఆ నమస్కారం చేయండి, ఈ పూజ చేయండి, లేకపోతే ఈ గింజలు తినండి, ఈ ఆకులు తినండి, క్యాన్సర్ తగ్గిపోతుంది. ఇన్ దీస్ times of when you have too much of information thanks to technology, thanks to AI, how do you use your emotional intelligence to match with your medical necessities of the body?
So as AI and technologies grow, along with the medical, the new development or new medicines are happening, new technologies which we use. So technology or AI can read data. Whatever you are saying, they will read and they'll give you, report. If you are doing a scan, they'll give you a report. They don't read it for you. Coming to AI, if you feed, you tell the AI that so and so I'm feeling, what is it? They will give you. But they don't read your face or your emotions. That is very important. I think only humans can do that. If a patient coming in front of me and telling that ma'am so and so thing, but also I could read whatever their face or their actions, their body movements saying me that. So that only possible with a person, a human being. So their emotional intelligence comes in. So the people whoever is using that, say whoever is using AI, they also have to understand that AI can help you to one extent, but again for certain things they have to come down to a person to talk. That empathy, that understanding, that will happen in between human beings. So therefore I would say that emotional intelligence and humans are irreplaceable in any ways. I mean, though it is medical or anywhere else.
So Sophie, I have been carrying this story with me for the last 11 years. And when I wanted to do a podcast, I wanted to understand. That is how I began my career. I just Googled psychology in the field of tennis.
Yeah.
And I then came up sports psychology. So I just Googled because I was trying to understand. I always felt this guilt. My friend said, it's okay, Pri, you didn't know. For 11 years, I wanted to I asked myself, Naku teliste would I have been doing anything better or anything different? For the next few years, I have been with my friend. We have been in touch ever since. She is one of my very best friends. She always has my best interest. But I still have that guilt. So when I wanted to open podcasts and open conversations on mental health in every aspect of life, cancer was one such thing. And when I Googled Onco-psychologist, I just Googled psychology in cancer,
Okay.
and Onco-psychologist came. So I went and searched Onco-psychologist on LinkedIn in Hyderabad. Fortunately or unfortunately, no one else popped up except for you. Okay, so that puts me in a position to ask you the next question. There might be people working around, or they might not know that there is a profession like onco-psychology where one can actually give in make a lot of difference to people and families. But that makes a lot of difference. So I want to ask you something. Is India ready where we can have onco-psychologists or mental health experts for our cancer patients, and not just as post-treatment measures, but through the process of treatment, survival, or diagnosis? Is India ready to have onco-psychologists as a continuous part of mental health care?
Well, first thing is first, if you are still holding that guilt, please understand that మీరు you see, maybe మీరు హెల్ప్ అయి ఉండేదేమో తనకి, but since she said that, that was okay.
Yeah.
Please believe her.
Yeah, I will after this. Yes.
Yeah, I mean that's it. Now what can we do now? We can undo things, kada. So that is one thing. And second is that in India there are very few hospitals, very few hospitals or very big hospitals, they have onco-psychologist in their board, but it's very helpful. When I went for my best friend, she's a medical oncologist, she herself diagnosed as a CA. So it's been a struggle since 2 years. She underwent surgery which long for almost 4 to 5 hours, and then chemotherapy sessions, and now she's on oral chemotherapy. She's working and she's doing all this, and she's managing somehow. Then I have seen in that hospital, it's a group therapy sessions. I haven't seen anywhere in this city. Okay, so I was wondering, so I had this idea of starting group therapy, because I know how much it will be helpful
Yes.
for the others. Because see, always if you are a single person, you always think that, oh my god, is this my only feeling, am I the only one is feeling this way, or because of me this happened, or what? Because the similar feeling you can find in 5 others, so you will feel much relaxed, because you can understand that you are not alone, because there are other people who feel the same way.
Yeah.
That is how it is. We can understand better, isn't it? So I would say there are a few hospitals, and I personally suggest that every oncologist center must have a onco-psychologist. That is very important. From the time they come for diagnosis and the time for investigation or diagnosis, till the time they go, and that process that will continue until they get a cure of the disease, or after 5 years or after 20 they stop. So I would suggest, but in India it's changing, and I hope things will change soon, and people will accommodate more onco-psychologists in the
I genuinely
oncology
hope
sectors.
So. I genuinely hope so, because this is a field of suffering and courage for the patient, for the families, and also for the psychologists involved.
Yeah.
That brings me to my next question. How do you take care of yourself? How do you take care of your mental health?
Oh well, I am someone very open about my emotional. So if I feel bad, I go and cry.
Yeah.
I am someone like that. I call up my friends, because peer supports are there. So very good friends of mine. I talk to them out of it, and if necessary, I go take a session for me, because it is very important. I am someone I feel for people. I am really empathetic, and I can really feel you in your shoes. I am that kind of person. So for me, it is very, very important. So I talk out, or I cry out, or I take counseling sessions, and a few of my best friends are from psychology. They are working as a psychologist. They are a great help for me, and I do exercise in terms of, I take short walks. Suppose if I have a heavy session, I go out, I just walk, I breathe, I do some grounding techniques and grounding exercises. Then these are them. I do a lot of journaling. That helps me a lot in terms of regulate my thoughts and emotions. Yeah.
I've come to the last part of the episode, Sophie. I just want to ask you something. Finally, if there is anyone listening right now, whether it's a patient or survivor or a caregiver, what is something that you want them to remember about the mind beneath the battles that are happening, and what is that one takeaway that they can just take away from this episode?
So, see, if you are a cancer diagnosed patient, or if you are a helper or taking care of the person, family members of the patient, I would say that, see, diagnosing cancer, it is not your fault. You have diagnosed and you are taking treatment. You are doing well so far. Second thing is, I want to say that you address your emotions. That is very important. Whatever you are feeling, you please address that. So for anyone listening, whether you are going through treatment, recovering, or supporting someone you love, the most important thing to remember is that your emotional health is a real part of your healing, not something extra on the side. When you let yourself feel your emotions instead of hiding them, your stress actually goes down. When you understand your treatment and keep small routines, it gives you a sense of control. And that helps your mind to stay steadier during the tough days. And having people around you, family, friends, support groups, it's very important. Strong support makes the whole journey feel lighter. And for caregivers, you are caring for someone. Your rest and well-being directly influence the person you are supporting. So taking a break help you, stay strong emotionally.
Cancer is a word that cracks the world, cracks the world beneath our feet. It changes lives overnight. Nothing is the same once a patient is diagnosed with cancer. Cancer vachina valke kaadu. It affects the families, it affects the relations, it affects friends, it affects the entire it affects the entire system around us. But that should not stop us from living our life. There is pain, but there is also help. There is loss, but then there is hope. I hope somebody, this is what I want you to remember. Some days you will fight, some days you want to give up, some days you'll laugh, some days you'll cry. Sometimes you'll go for walks, but sometimes you do not feel like even getting up from your bed. But that is the time you need to hold on, telling, I can do this, because you have support, you have families around you, and then you have experts to deal with this kind of issues. And if today felt heavy, remember that tomorrow you will feel better, because you are not alone in this. You have a support system, and then you have experts who are equipped to deal with this. And you're allowed to feel scared. You're allowed to feel hopeful. You're not defined by what is happening to you, or you're not defined by what has happened to you, but you're defined by how you wake up every morning, no matter what the night has handed you with. And if you feel this episode has made any meaning, or if this episode has brought any value to you, share it with somebody